Good day, I am Casey Anikda of BSN3 and today I am going to perform lungs and thorax assessment. Assessing the thorax and lungs, it is an essential component of physical examination. This is necessary to determine if there is any abnormality detected, and if it's left untreated, it may result or lead to chronic disease or worsen to death. This involves inspection, followed by palpation, percussion, and then auscultation of both anterior and posterior lateral thorax. First is the planning. For the planning, check the doctor's order. This is to verify if we are handling the right patient. Female patient, Miss Lovely Ibay, for lungs and thorax assessment. And these are the materials needed: stethoscope, alcohol, wristwatch, marker, pen, tape measure, and the clipboard for the patient's record and assessment. Next is wash hands before doing the procedure. Perform hand washing. This is to prevent the gross contamination between the nurse and the client. Last is wear PPE if needed. This is to provide extra protection and safety. For the implementation, prior in performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how she can participate. Discuss also how the result will be used for planning further care or treatments. This is for the patient's education and awareness on what we are doing.
Ma'am, I am Casey Anikda of BSN3 from La Consolacion University, Philippines, your student nurse for today. May I ask you some questions? Ma'am, what is your name?
Lovely Ibay.
What name can I call you, ma'am?
Lovely.
What language do you prefer?
English.
Your age?
11.
Your birthday?
July 8, 2010.
Okay, ma'am, thank you. Ma'am, I am going to perform thorax and lungs assessment. This is for the complete physical examination. As the procedure goes by, I am going to touch and see other parts of your skin. This is necessary for that if there is any abnormalities present in your lungs or in your thorax, we can easily treat it, or we can do some further care treatment for that.
Next is perform hand hygiene and observe other appropriate infection procedures. The rationale for doing this is to prevent the spread of infections and gross contamination.
After interviewing the patient, of course, we need to sanitize our hands using this alcohol. Sanitizing your hands, this is to prevent the gross contamination between the nurse and, of course, between the client.
Next is provide for client privacy. In women, drape the anterior thorax when it's not being examined.
For the patient's privacy, ma'am, I am sure that all the curtains and doors around us are closed. This is for your privacy. And as my client is a woman, as you can see, the anterior thorax is draped for her privacy.
After that, inquire if the client has any history of illness, including cancer, allergies, tuberculosis, and for her lifestyle habits such as smoking and occupational hazard, example is inhaling fumes, and medications being taken on her current problem, example is wheezing, swelling, coughs, and pain. The rationale for doing this is for the nurse or healthcare provider to have a history and background about the client.
After we mention the privacy of the client, ma'am, I am going to ask some questions again as inquiry for your history or background. And that's before we proceed to the lungs and thorax assessment. Number one question, ma'am. Do you have any history of illness such as cancer, allergies, tuberculosis?
No.
Lifestyle habits, do you smoke?
No.
In your occupational hazards, do you inhale in fumes?
No.
Current medications taking for the current problems such as wheezing, coughing, swelling, pains, do you experience that?
No.
Okay, ma'am. Thank you.
Now let's proceed for the assessment. First is the posterior thorax. For the inspection, inspect the shape and symmetry of the thorax from posterior and lateral views. Compare the anterior-posterior diameter to the transverse diameter.
Before we proceed to the assessment, I would like to ask for your full cooperation for this. Ma'am, can you please stand up and turn around? Now let's proceed first for the posterior thorax of the patient. For the inspection, inspect the posterior thorax of the client. As you can see, the posterior thorax of the client is symmetrical.
Next is inspect the spinal alignment for deformities. If the clients can stand from a lateral position, observe the three normal curvatures which are cervical, lumbar, and thoracic. And to assess for lateral deviation of spine or scoliosis, observe the standing client from the near, have the client bend forward at the waist, and observe from behind.
After we inspect the posterior thorax are symmetrical or not, ma'am, can you please stand up? I am going to inspect your three normal curvatures which are cervical, lumbar, and thoracic. Ma'am, can you please bend forward in your waist? As you can see, the three curvatures are normally aligned, which means that the client has no scoliosis.
For the palpation, palpate the posterior thorax. Assess the temperature and integrity of all skin. For clients who have respiratory complaints, palpate all thorax areas, full bulginess, tenderness, or abnormal movements. Avoid the deep palpations for painful areas, especially if a fractured rib is suspected. In such a case, the palpations could lead to displacement of the bone fragment against the lungs.
The palpations of the thorax, ma'am, I am going to assess your skin integrity and temperature, and also to assess if there's any bulginess, tenderness, and swelling around your posterior thorax. Temperature is normal, and skin integrity is normal too. Let's proceed for the palpation. For the palpations finding of the posterior thorax, there are no swelling, tenderness, and bulginess present in my client posterior thorax.
Next is palpate the posterior thorax for respiratory excursion. Place the palms of both of your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Ask the client to take a deep breath while you observe the movement of your hands and any log-in movement.
Let's proceed for the palpation for the respiratory excursion. Ma'am, when I do some hand movements, can you please take a deep breath? Inhale, exhale, inhale, exhale, inhale, exhale, inhale. The findings for this respiratory excursion is normal because, as you can see, my fingers are moved or can move laterally without any barrier or bulginess.
Palpate the thorax for tactile premitus, the faintly perceptible vibration felt through the chest wall when the client speaks. Place the palmar surfaces of your fingertips or the lunar aspect of your hand or closed fist on the posterior thorax, starting near the apex of the lungs. And then, ask the client to repeat such as words as blue moon or 1, 2, 3. Repeat the two steps, moving your hands sequentially to the base of the lungs. Of course, compare the premitus on both lungs and between the apex and the base of each lung, using either one hand moving it from one side of the client to the corresponding area on the other side, using two hands that are placed simultaneously on the corresponding areas of each side of the thorax.
Palpations of her vocal premitus. Ma'am, as I move my hands, can you please say blue moon or 1, 2, 3?
Blue one, blue one, blue
Thank you, ma'am. As you can see, in these findings, the posterior thorax or the vocal primitus of my client are the same, which means it's normal.
For the percussion, percuss the thorax, ask the client to bend the head and fold the arms forward across the chest. The rationale for doing this is to separate the scapula and exposes more lung tissue to percussion. Percuss in the intercostal space at about 5 cm or 2 inches intervals in a systematic sequence. Compare one side of the lung with another. Percuss the lateral thorax every few inches, starting at the axilla and working down to the
We are
atrium.
done with the palpation, and now let's proceed for the percussion of the thorax. Ma'am, can you please bend your head? Cross your arms forward on your chest. This is to expose your scapula and more lung tissues. We are going to start with the axilla down to the atrium. I am going to mark with the marker for the, or as we heard, the dullness of the sounds from the resonance of the sound. Let's proceed. Now, this is the dullness of the sound. Now, let's proceed to the other side of the lungs. Here again, the dullness of the sound. Another dullness of the sound. Now, as you can see the two markings, we're going to measure the distance between the two markings for the diaphragmic excursion. The diaphragmic excursion of my client is 5 inches, which is normal, with the normal which are 3 to 5 inches.
For the auscultation, we need to have the stethoscope. Auscultate the thorax using the flat disc diaphragm of the stethoscope. The diaphragm of the stethoscope is best for transmitting the high-pitched breath sounds. Use the systematic zigzag procedure used in percussion. And then after that, ask the client to take a slow, deep breath through the mouth. Listen at each point to the breath sounds during a complete inspiration and expiration. And then, compare findings at each point with the corresponding point on the opposite side of the thorax.
We are done with the inspection, palpation, and percussion. Now let's proceed for the auscultation. For the auscultation, we're going to use the stethoscope. Auscultation is done for the breathing sounds of the client. Ma'am, as I move the stethoscope, can you please take a deep breath? Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. The breathing sound of my client is normal.
Now, let's proceed for the anterior thorax. First is inspect breathing patterns, which are respiratory rate and
For
rhythm.
the posterior thorax. Now let's proceed with the anterior thorax of the patient. For the respiratory breathing and pattern, ma'am, can I have your hand? After 1 minute of the taking of the respiratory rate of the client, My client respiratory rate is 18, which means within normal range of 15 to 20.
Next is inspect the costal angle. Angle formed by the intersection costal margins and the angle at which the ribs enter the spine.
We're already done for the assessment of her respiratory rate, breathing pattern. Now let's proceed for the inspection. I'm going to inspect her intercostal cage angle. Both two angles are on 90 degrees, which means normal.
For the palpation, palpate the anterior thorax like how we palpate the posterior thorax.
We're done with the inspection. Now let's proceed for the palpation of the anterior thorax. Ma'am, as the palpation begins, I would like to inform you that I'm going to touch this part of your breast as part of the procedure. Palpation of her anterior thorax. This is to assess her skin temperature and integrity, and this is to also assess if there are swelling, baldness, and tenderness in the patient's anterior thorax. And as I palpate it, everything are normal.
Next is palpate the anterior thorax for respiratory excursion. Place the palms of both of your hands on the lower thorax, with your fingers laterally along the rib cage and your thumbs along the costal margin. And then, ask the client to take a deep breath while you observe the movement of your hands.
Another palpation for respiratory excursion. Ma'am, as I move my hand, can you please take a deep breath? Inhale. Exhale. Inhale. For the respiratory exertion, as you can see, my fingers are laterally stretched, which means respiratory exertion of my client is normal.
Palpate tactile premitus in the same manner as for the posterior thorax and using sequence shown in. Note that if the breasts are large and cannot be retracted adequately for palpations, this part of the examination is usually
For
omitted.
the last palpation, ma'am, as I move my hand, can you please take a deep breath and repeat such as words like 1, 2, 3 or blue moon.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
For the tactile premitus, both tactile premitus of the anterior thorax of my client are the same.
For the percussion, percuss the anterior thorax systematically. Begin above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Compare the lung one side to the lung on the other side, and then displace the female breast to facilitate percussion of the lungs.
We are done with the palpation and let's proceed for the percussion. I'm going to start above the clavicle of my client. Starting from the clavicle down to the rib or the hip rib of the client. After percussion, the comparison of both lungs are normal. There are no dullness and resonance of the sound present.
For the auscultation, we need to have a stethoscope. Auscultate the trachea.
After we did the inspection, palpation, and percussion, the last is auscultation using the stethoscope. Ma'am, I'm going to auscultate your trachea for your breathing sound. The breathing sound of my clients are normal.
Next is auscultate anterior thorax. Use the sequence used in percussion number 7, beginning over the bronchi between the sternum and the clavicles.
And then after that, using the zigzag procedure, let's start with the bronchi. The breathing sound of my client is normal.
Last is for the documentation. Document findings in the client record using printed or electronic forms or checklists supplemented by the narrative notes when appropriate. And then, if there's any abnormality, report it to the appropriate
We
person.
are done with the inspection, palpation, percussion, and auscultation on your posterior and anterior thorax. Now let's proceed for the documentation and the findings of your assessment or examination. Now wait for a while. I'm going to get and do the narrative report for you to narrate. We are done with the thorax and lungs assessment, and I am going to discuss the findings of your assessment or examination. For the posterior thorax, first inspection, your thorax are symmetric, your spine is normally aligned, which is good. For the palpation, there are no swelling, no barriers, and no tenderness. You have a normal skin temperature and skin integrity, which are good. For the percussion, ma'am, respiratory excursion are normal. Diaphragmatic excursion is normal too. And for the auscultation, ma'am, you have a normal breathing sound, normal respiratory rate of 18, and normal breathing pattern. Now let's proceed with your anterior thorax. Anterior thorax, your intercostal angle are 90 degrees, which is good. There are also no swelling, tenderness, skin integrity, and no normal temperature. For the respiratory excursion and diaphragmatic excursion, for the percussion are normal too. For the auscultation of your trachea, there is a normal breathing sound, normal respiratory rate 18, which is normal, and normal breathing pattern for the zigzag procedure we've done. Ma'am, thank you for your full cooperation. You have a normal and good lungs and thorax assessment.